A unique benefit to VNS therapy is the VNS Therapy Magnet. The magnet may provide additional seizure control and could also curb potential side effects of stimulation during activities such as exercising, public speaking, or singing. The magnet is used if you feel a seizure is about to start or when you are experiencing a seizure. You or a caregiver can activate the magnet mode by swiping the VNS Therapy Magnet over the chest area for 2 to 3 seconds. This will start an additional dose of stimulation which could stop or shorten a seizure, decrease its intensity, and reduce the recovery time after a seizure. If the seizure continues after the additional stimulation has ended, it's okay to repeat the magnet swipe. If you want to pause the stimulation for a short period of time, hold or tape the magnet over the generator. Remove the magnet and your normal mode stimulation will restart. We encourage you to document the date and time of magnet use and what responses were achieved so this can be shared with your neurologist at upcoming visits. Always carry the VNS Therapy Magnet with you so you are ready to respond, but try to keep it at least 10 inches away from computers, credit cards, televisions, and other magnets. The VNS Therapy Magnet is the only magnet that should be used with the VNS Therapy system. You can contact your doctor if you need additional magnets. The VNS Therapy Magnet is a revolutionary way to have even more control over your life with VNS Therapy.